In this module, we're going to be talking about how cancer can impact occupational performance. And as you can appreciate, we will see clients with cancer across the lifespan, across all ages, demographics, lifestyles, diversity factors, socioeconomic status. Cancer can impact anyone at any age, at any time, and it can be in any organ. So, where the cancer is, what type of cancer it is, the severity of the cancer, all of the personal and factors of all the client factors, all of those will depend on how we provide intervention for the client. The other thing to consider is if this is a malignant terminal cancer, or if this is a benign tumor resection, that will also impact how we work with this client and how we craft our interventions. So for somebody who has a malignant tumor who is going into hospice or palliative care, our interventions are going to look more like caregiver training and comfort training, managing, helping manage depression and stress and relaxation. And our therapies might look more, or interventions might look more like that, versus somebody who's just gone in to have a benign brain tumor in their brain resected and they just have mild weakness. So we're working on rehabilitation in that context. So we need to understand the type of tumor, the severity of the tumor, and that will really help us determine what our intervention is. The other takeaway I really want you to think about is we do not diagnose. We do not give prognoses on somebody who has cancer. That's not our wheelhouse. So we go in and we treat the client based on the barriers and the client club factors, performance skills that have been impacted by the cancer. So all of that to say, cancer and its treatment have an impact on occupational performance in many aspects of an individual's daily occupational needs. Occupations can be impacted by client factors of pain, chemotherapy-induced peripheral neuropathy, compromised bone, cancer-related fatigue, cancer-related cognitive impairment, lymphedema, psychosocial concerns, and there could be impact on sexual health and intimacy. Since cancer is considered a chronic condition, many of these concerns may have lasting effects. Therefore, addressing the daily occupations and occupational performance of the individual throughout the cancer treatment as well as post-cancer treatment is an important aspect of occupational therapy care. So I'm not going to go through each area of occupation that will be impacted because, as I've already said, it really depends on the client. And therefore, what areas of performance will be impacted. It depends where that cancer is. If somebody has a cancer in their lower extremity that ends up with some level of amputation because of that cancer, that's going to look very different. And I'm going to be addressing things very different from somebody who has a brain tumor. And again, malignant versus benign. So really understand what the cancer is, but ultimately what our role is with the person who has cancer. So it's a big topic. Don't hesitate to reach out, and I look forward to talking with you soon.